Hey, veterans and families, it's Craig here from Royal Rock Counseling and Consulting, and welcome to our featured topic for the month of November: 30 VA claims in 30 days. And make sure to mark your calendars because on November the 11th, I'm going live right here on this channel to answer frequently asked questions about VA claims and conditions across the web. To make sure you're fully equipped, I'm going to offer two resources that I use with veterans every day. The first resource that I'm going to offer is the three-stage VA Claim Playbook, your step-by-step guide to understanding, organizing, and strengthening your claim. The second resource I'm offering for free is the Mental Status Examination Assessment Decision Tree. This tool is a simple but powerful tool to help you understand how mental health evaluations impact your claim. Together, these are the only two documents you'll need to successfully file and win your VA claim. So hit that subscribe button, tap the notification bell, and don't miss a single day of this series. Now, let me remind you that the content in this series is for educational purposes only. It's not intended for legal, clinical, or medical advice, and there's no therapist or client relationship established. Royal Rock Counseling and Consulting LLC is not a VA accredited agent, attorney, or Veterans Service Organization, and it's not affiliated with the Department of Veterans Affairs. We do not prepare, present, or prosecute VA claims, but may provide administrative guidance and referrals to qualified professionals. Vets and families, I'm honored to walk with you through this process, helping you move from confusion to confidence. So let's get started. Hey, vets and families. Today we're going to talk about a condition, a VA compensated condition that is pretty popular among veterans with regard to conditions to file, and that is a condition from the digestive system called Gastroesophageal Reflux Disease, or what's commonly known as GERD. This is VA Diagnostic Code 7206, and it involves acid reflux that damages the esophagus, leading to esophagitis, strictures, and chronic swallowing difficulty, otherwise known as dysphagia. Now, the VA now includes GERD-like conditions under Diagnostic Code 7206, and it focuses on recurrent or refractory esophageal strictures. Conditions covered include peptic stricture, drug-induced esophagitis, Mallory-Weiss syndrome, eosinophilic esophagitis, and others. And we're going to break down each percentage, like we've done all these videos, to talk about GERD and how it shows up in each level of VA rating, and how you can make sure that in that percentage, or in that particular category, to see if your GERD symptoms match up to that particular percentage. You always want to track the symptoms, and we're going to go over each particular level. Okay, so now let's get into how the VA considers GERD on the rating scale. And the VA rating criteria for Diagnostic Code 7206 is at the 80% level. Refractory stricture causes dysphagia plus aspiration, malnutrition, or major weight loss requiring surgery or PEG tube. And I get this directly from 38 CFR Part 4, actually 30 CFR Part 3, which outlines specific VA criteria with all of the codes. And this is the 80% level for GERD. 50% level is recurrent refractory stricture requiring 3 plus dilations per year, steroid use, or stent placement. If you'll notice, these are very specific requirements in each category for those percentages. At the 30% level, recurrent stricture requiring less than or equal to 2 dilations per year. You notice that those three categories all have something in common. That means that there are recurring strictures, and there are different aspects of how often and frequencies of how often the strictures recur, but pay very close attention to the GERD symptoms and these recurrent strictures. at those levels of 30, 50, and 80%. At 10%, there is esophageal stricture, and it requires daily meds to control the dysphagia. So what this means is um, you do have GERD, but the level to which your GERD is operating in the system, it can be controlled by meds. And so that's why it's assigned a much lower percentage than the others. You see it goes from 30 to 10. And at a 0%, remember, anytime you see 0% for a rated condition in your VA records, that means that the VA has identified that you have that you do have a diagnosis, that you do have a condition, and the VA recognizes that it is something that needs to be treated, but they have simply decided that it does not rise to the level of compensation. So 0% means a documented history without daily symptoms or medication. Here's some keynotes. GERD has to be documented by Barium Swallow, CT, or EGD. It applies broadly to chemical, infectious, idiopathic, or radiation induced esophagitis, and it defines recurrent as symptoms return less than 4 weeks after the dilation of that area. And refractory is a failure after greater than or equal to 5 dilation sessions every 2 weeks. So those are the definitions of recurrent and the definitions of refractory. Very important when you're going for your GERD claim. Okay, now we're pivoting to some case law, but remember, every time we pivot to case law, I have to always put this disclaimer in there. These are case law examples, okay? Please do not take case law and slap it on your initial claim. Don't take case law and say, because this case says this, and that means I need to be rated for this condition because I've got the same thing, and therefore the VA is wrong for. Don't do that. Do not do that. I'm telling you now. These are case law examples. What you should do to use these as examples effectively is study the case, right? See how it's applicable to your claim. Make sure you have the correct rating system, the proper rating scale, the proper body part, those kinds of things. And then look at your own medical history with regard to that particular body type or body part, and make sure that it's similar or a similar, at least a similar situation or similar symptoms to what you're going through. That's what I would suggest whenever you use any case law, because it has to be used correctly. So I have the citation number here for a Board of Veterans Appeals case that was adjudicated in 2020. The veteran was awarded a higher rating for GERD, where records showed recurrent dysphagia, we talked about that, and esophageal dilation procedures twice a year. The board emphasized objective medical evidence, EGD, and gastroenterologist notes over subjective symptoms. The takeaway is that without endoscopic documentation or gastroenterology notes confirming frequency and severity, the claim may default to 10% or 0%. And here are some key precedents with regard to GERD claims and boards of veterans appeals. Midlighter versus West in 1998. When symptoms overlap with another digestive condition, the VA must attribute inseparable symptoms to the service-connected disability. And in Gilbert versus Derwinski in 1990, the benefit of the doubt applies even if evidence is in approximate balance. So in these cases, it appears, at least from case law that is precedented in GERD, that the benefit of the doubt is typically going to go in favor of the veteran unless there is evidence to the contrary. So just things to keep in mind. These are example cases. Not every GERD case is going to be the same, but these are some things that you can refer to and use if it's applicable to your specific GERD case. Okay, before we go over evidentiary support strategy for post-service claim in the case of GERD. Let me just say that GERD is one of those interesting VA claim conditions. It's not something that you might notice right off, because oftentimes a lot of veterans struggle with GERD and they don't even know that that's what it is. They think they just might have, like, they might just be choking, or they might have, you know, just a hard time swallowing or what have you. They don't connect it to, hey, this might be a digestive system issue that I'm having. And it's associated with pain, difficulty swallowing, barium, There could be coughing, things of that nature. So GERD is one of those things that you just kind of have to keep an eye on, particularly if there are things that are happening with your body and to your body, that you don't exactly know what's happening, what's going on, in the esophageal area. You may have GERD and just may not know it. So it's important to make sure you go to regular checkups with the doctor to see if everything in there is okay, particularly in the throat area, to make sure you don't have any, or in the stomach area even, to make sure you don't have any digestive issues that are associated with GERD. But to strengthen your GERD claim, you want to have medical evidence, Barium Swallow or EGD documenting esophageal narrowing, ulceration, or inflammation, records of dilation, stent placement, or surgery frequency. It really amazes me that by now, people don't necessarily get copies of medical records. It's really easy to get copies of medical records now. I know it was much more difficult back in the day before we switched to electronic records, back when there were paper records. But now it's relatively easy to get documented evidence of anything that you have experienced or any diagnosis you have from military doctors, even, or VA doctors, or even private medical doctors, because a lot of those systems are more updated and more current. So make it a practice of keeping medical documentation no matter what type of doctor that you go to. Records of dilation, stent placement, or surgery frequency have to be there, and as well as nutrition assessments or documented weight loss due to swallowing issues. Layer buddy statements, statements describing choking, food sticking, vomiting after meals, or reflux at night. That acid reflux, right? Um, that occurs sometimes when you have symptoms of GERD, just so that gastrointestinal walls, all those kinds of things that happen, you want to make sure you take note of those things happening in your body. If your spouse or roommate has a testimony about dietary restrictions, choking incidents, or weight loss because you can't hold down food and eat, all of those things are things that you might want a buddy or family or friend or coworker, spouse write for you. And then there's specialist nexus opinions. Now, you guys know how I feel about nexuses. You know how I feel about nexus letters. I don't mind you getting a nexus opinion from someone who sees you regularly, but let me remind you that there is a lot of attention on VA claims, and there will be a lot of attention in the future on VA claims. So just make sure that your information is current, accurate, and complete, and make sure that whatever documentation you are providing is documentation of situations and circumstances that are happening to you. So, a gastroenterologist connecting GERD or esophageal stricture to service factors such as NSAID use, stress, diet, or exposure, for example, burn pits or chemical agents. And then symptom tracking. Keep a symptom log showing dysphagia frequency, choking episodes, and daily medication needs. And it doesn't even have to be that formal, guys. Just make sure you jot some things down, write the date that it happened, write what was going on at the time, how you felt, what occurred, and there's your symptom log right there. And you might even throw in there, this is what I did about it. Even if you tried to self-medicate and it's still, you still experienced pain symptoms after that, keep that in your log so that when you actually go file your claim, you'll have what you need. I hope you guys enjoyed this video. Thank you for watching. If you want any more information about the subject of this series, be sure to check out the playlist right here. And remember, live royally and live well. Thanks for watching, and I'll see you in the next one.